Hey, Dr. Mike here, and today I want to answer a question that I get often, and that question is, if I don't hear a crack, does it mean I didn't get adjusted? And so let's just talk about what that crack is, just so you know what the noise is. And the noise that's usually reproduced during an adjustment is called cavitation. Cavitation is the release of air. So in other words, if I take my knuckle and I open it, I don't know if you heard that, but it released air and it created a, that's called cavitation. Now I could pull that same joint apart and nothing happens. And the reason that is because inside the fluid around my joint, there's air. There's CO2 and nitrogen air bubbles. And when I open the space, I release those air pockets, create a pop. That's cavitation. So when we do an adjustment, the joints that move most freely are typically the facet joints back here. And they will move, and sometimes they will release what that noise is, that cavitation, and create that pop. And when it does, you feel that. Now, that noise is not it's not the marker of a good adjustment. The marker of a good adjustment is creating balance and mobility. So there's a lot of adjustments that don't actually reproduce that noise. As a matter of fact, probably half the adjustments we use here in the office are not intended to reproduce or make a cavitation noise. Now, the other noise that people will hear sometimes is a grinding noise, where when they move their spine or their shoulder, their arm, their knee, they hear a crackle. And that crackling sound is called crepitus, and it's as bad as it sounds. The name is from the word decrepit. Crepitus is cartilage, the wear and tear of cartilage. And when you move, every time you move, you'll hear a little bit of a sound. But going back to the cracking or the cavitation sound, if you don't hear that, don't worry. It doesn't mean you didn't get an adjustment. It just means that you didn't release air in that joint space at that time. So that's not a big deal. Cracking isn't something that's necessary for a good adjustment to take place. As a matter of fact, like I said, 50% of our adjustments don't even reproduce that noise in the first place. So I hope that puts a little more understanding on what that cracking sound is and why it's not an important aspect of the adjustment. Sometimes when you get an adjustment, you'll hear that noise, you'll feel some relief, but they don't go hand in hand. They're not one and the same. So hope that helps. And remember, stay informed and get adjusted.